There is a rise in the trend of so-called breakthrough COVID cases. That is when someone who is fully vaccinated tests positive for the virus. Joining me to talk more about this is Dr. Rick Martinello, Medical Director of Infection Prevention at Yale New Haven Health. Doctor, thank you for being here.
Thank you for the invitation.
So tell us, are the symptoms different for people who are fully vaccinated and then come down with COVID-19?
Now, we're seeing the same range of symptoms. Oftentimes, people have fever, a new cough. They may feel achy all over. I think it's really important to recognize, though, that while we are seeing occasional people who are vaccine breakthroughs, people fully vaccinated who still develop COVID, the overwhelming majority of our patients who we're seeing with COVID are really the unvaccinated, and in particular, those who have severe enough disease to be hospitalized.
So what do people need to know if they're vaccinated and then they're exposed to someone who tests positive?
Well, we know that the vaccines work extraordinarily well, but they're not perfect. The vaccines we know can reduce your risk of getting COVID by about 95%, but there still is some risk that you may get it. And so especially if you're out in an area where there are other people who you're not sure if they're vaccinated or not, or that may possibly be sick and contagious, it's still important to keep your mask with you, put it on when you have those opportunities where you can't physically distance from people who may potentially be contagious.
And we know there's been a lot of talk about booster shots for the COVID-19 vaccine. What's the latest on that? Do we think that people will have to get them?
We're waiting to hear further clarity on this. Right now, there's no recommendation for booster shots, but we are hoping to better understand whether this will be a requirement over the next few months.
All right, Dr. Rick Martinello, thank you so much. Lots of good information there. Thank you for joining us.